Hello everyone, this is Wistful here, and welcome to Surgery Squad. These are basically the type of surgery games that are on the web that you guys can go off and play for yourselves now. You can go do it. Link in the description. The link for this game will be in the description below. And I figured I could, do this one, besides, all the other gamings I, don't usually normally do. I figured I could do like a web browser game, and this one just looks nasty. It's like the, I don't know, like the tonsillectomy infection. I'm not really too sure what the hell. No, go away. Start, please. Do not disturb me with ads. Let's get right into it.
Welcome to Surgery Squad's virtual tonsillectomy surgery. I'm Dr. Jeff.
Hi, Jeff.
Today we'll be removing a young man's tonsils. This is a common operation that's performed when a patient suffers from frequent bouts of tonsillitis. It's most often performed on younger patients, but adults can need it as well. The tonsils are located at the back of your throat on either side of the uvula. That's the little punching bag thingy that hangs down in the middle.
I know
Tonsils are infection fighters, but occasionally they lose the fight and get infected themselves. They become red and enlarged and can sometimes make it hard to breathe and swallow. Normally we treat this with antibiotics, but when tonsillitis reoccurs frequently, we remove them because the infection can cause more serious damage. Our patient was given a sedative before being brought into the operating room, and the anesthesiologist will help put him completely under. Help me out and place a breathing tube in our patient's nose to assist with breathing while we operate.
Okay, so this is a web browser game. Also, the reason why my webcam's to the right and not to the left is because I decided, just to do it.
We need to get our patient's mouth open wide so we have room to work. To do that, we'll use a special mouth gag retractor that opens the mouth, depresses the tongue, and locks into position.
Okay.
Why don't you take a crack at that?
This is weird.
Great job. That should give us plenty of room.
That does not look like plenty of room. Now we have to reach in and
grab the infected tonsil with the tonsil forceps. We need to pull it to the side to expose the connective tissue. Can you do that for me?
Of course I can. Anything. Oh, my neck feels all weird now. It's disgusting.
Nicely done. With the tonsil extended out, we need to place this electrocautery device at the tonsil's base. The device uses high-frequency current to cut away tissue and seal off the blood vessels at the same time.
Oh, this is gonna hurt.
By removing the tonsils this way, we reduce bleeding and allow the patient to heal faster. Now that the tonsil has been cauterized, we reach in with a tonsil guillotine clamp. The clamp severs the last of the connective tissue and allows us to remove the tonsil from the throat. Clamp the tonsil and pull it out, would you? We'll bring the electrocautery device back in here and apply it to any bleeding areas.
Oh my goodness, the screen's acting all weird.
Because this part of the throat heals quickly, we won't need any stitches. Now we repeat our steps on the other side of the throat. Extend the other tonsil with the tonsil forceps.
Oh, that's horrible.
Just like the other side, we'll cauterize this tonsil to release it, while keeping blood loss.
Oh shit, I didn't let him finish. Ooh.
And finally, we need to remove the tonsil.
Oh God.
And don't forget those bleeders.
Well, yeah, of course I'm not. I'm a doctor.
I'll clean out the mouth with some irrigation and suction, and then we're all done.
I don't want to choke him.
We'll send our patient to recovery for 8 to 10 hours, and more than likely he'll be able to go home later today. Once he's sent home, our patient will be put on a course of antibiotics. He'll need to keep hydrated with cold water or sports drinks. And if he gets hungry, he can have cool, soft foods like fruit pops, gelatin, sherbet, pudding, and of course, ice cream. Getting a little hungry?
Yeah?
Thanks for stopping by SurgerySquad.com. While you're here, check out some of my other spectacular surgeries. They'll always stand the test of time, unlike my hairline.
You rhymed that. Okay, that was really gross. I really did not expect that. Tonsils, that's what it's called. Look at this. Okay. Okay then. Alright, so this is another one called this is another surgery game called Before You Stitch In or something. It's plus all of these free games will be in the description below. But yeah, I decided to do free games because that one was actually kind of short. I'm not really too sure how long this is gonna be, but let's just give it a go, shall we? This one's carpal tunnel. Like carpal tunnel surgery, I think is what it's called. I'm not really too sure how to say it, really. But yeah, let's get right into it. This game's all fun. That one was disgusting though, that last one. That tonsil one.
Welcome to Surgery Squad's virtual limited open carpal tunnel release surgery.
Hey Jeff.
I'm Dr. Jeff.
Yeah.
And I will be guiding you through the procedure today.
Thank you, Jeff.
Carpal tunnel syndrome is characterized by a tingling numbness or pain in your hand, and sometimes forearm. It develops due to the swelling of a ligament in the wrist known as the transverse carpal ligament. The swelling of the transverse carpal ligament creates pressure on the median nerve in your wrist. This nerve is responsible for supplying feeling and movement to various parts of the hand. Performing repetitive motions with the hand or wrist over a long period is the main cause of carpal tunnel syndrome, and the condition is more commonly seen in women than men. Researchers have also discovered that other medical problems such as alcoholism, arthritis, diabetes, obesity, and infections could also lead to carpal tunnel syndrome. Today we'll be operating on a patient who has been diagnosed with carpal tunnel syndrome after experiencing numbness and weakness in the palm of his hand and thumb. Now let's put on our gloves and get started.
Okay then.
The limited open carpal tunnel release surgery is performed using a local anesthetic that numbs the carpal tunnel area of the hand and wrist. If a patient is nervous or uncomfortable, I'll sometimes use a sedative as well. A sedative is a drug given through an IV that places the patient in a dreamlike state. However, our patient today will only receive the local anesthetic. Go ahead and get the operating area numb.
Okay then. Oh, needles. Oh, I hate needles. Get away! Fuck's sake. Okay, we have major lag for some reason. Oh, needles hurt, man. Owie. Needles suck. They hurt.
With the wrist anesthetized, we can now begin the operation. I've already tied a tourniquet around the patient's upper arm. Can you go ahead and outline where we'll be making our incision?
Oh, no. Okay. Sure. If the game will let me. We got this. Okay, now give me the other one. Oh my god, ads. Will you fuck off? Go away. I don't care. Go away. Oh my god, I hate ads. Go away. Fuck off. I don't give a shit about you ads. Okay, still okay, good enough. Let's see here. Gonna draw an F here. Gonna draw a sun here. Because why not? Gonna draw a sun here. That's apparently mad and angry. Very, very angry. Angry son does not like it. Okay, whatever. Get you with your mustache, in the beard, or body, or whatever. Oh, I can just draw your whole hand. How would you like this? I can just draw your whole hand. I can draw the whole hand. Look at this. Okay, whatever. Let's get into it then.
Looks good to me. We'll be making a 3/4 inch incision at the intersection of those lines. Now take the scalpel and make the incision.
Ooh. Okay.
Nice. I couldn't have done it better myself. Now we'll spread the incision wider to expose the transverse carpal ligament. This band of tissue is the cause of the problems. Place the retractors into the incision and spread it open.
Okay.
I think you're a natural at this. With the transverse carpal ligament exposed, I'll need you to slip a carpal tunnel guide into the incision. This is a blunt-tipped instrument with a groove on the upper surface to accommodate a special knife. The carpal tunnel guide is placed down the carpal tunnel and underneath the ligament and is used to protect the underlying nerve and tendons. Go ahead and push the carpal tunnel guide into place.
Oh!
Once it's in position, you'll advance our special knife down the guide to split the carpal ligament. As you push the knife forward, you will feel it cutting through the carpal ligament.
Oh, okay. How do you know if this works, though?
Perfect. With the transverse carpal ligament cut, the median nerve is no longer inflamed. Now we can begin to clean and close the incision. Go ahead and irrigate the wound.
Oh, jeez.
When you're finished, I'll release the tourniquet, allowing blood to flow back into the hand. Great. Now you'll close the wound using non-absorbable sutures.
Ooh! Oh, it just does it for me. Thanks, game.
With the wound closed, we'll inject additional numbing medicine around the operating site to help relieve some of the immediate pain the patient may feel after surgery.
Oh. Oh, I don't want niches. Bitches get stitches.
And lastly, we'll place a small dressing over the wound to absorb any residual blood.
Alrighty then.
We'll immobilize the wrist with a splint and a sling, and after 1 to 3 hours, our patient is sent home to recover. Our patient needs to keep in mind that because of some of the medications we used, he may experience a bit of nausea. He will also be given pain medication to help relieve the discomfort he'll feel in his wrist. Once our patient returns home, he'll be asked to follow specific instructions for driving, exercise, and medication.
Your mouse
This will include
glitching,
keeping
Jeff.
his hand elevated above his heart for the first few days after surgery. About 2 weeks after surgery, we'll remove our patient's stitches, and he'll be gradually allowed to return to his normal routines in 4 to 6 weeks. And that's a limited open carpal tunnel release surgery. Thanks for stopping by. Why not try out some of the other amazing surgeries here on SurgerySquad.com?
Okay then. Well, basically that's it for this video. I know this wasn't really much or really exciting or anything, but I figured, I could, show these games off or show this website off. This is a really cool website, but I figured it could be, a fun, great idea, to show you guys. And I know I don't really do these games too much. I don't really do web browser games really too much, but I figured I could do something different instead of having it be the same thing over and over again. The links for these games will be in the description below, or at least just the website. I'm not too sure. I think I'm just going to do the website, and you guys can find it yourselves. But for now, thank you all so much for watching. If you liked this video, leave a like, leave a comment, hit subscribe for more, and I'll see you all sooner or later. Bye-bye.